Okay, so good evening, everyone. Today we will read Theridion Curasavicum. You can see in the picture. This is also belonging to the spider group of family. Okay, so first we will talk about the introduction, which is said by Dr. James Tyler Kent in his book. The name of the book is Lectures on Homeopathic Materia Medica, and that is published in 1904, which is containing 187 medicine. Sometimes कई बार आता है कि lectures on homeopathic materia medica is written by whom? So answer will be Dr. James Tyler Kent. कब आया था? 1904 में आया था. That is 1904. कितनी मेडिसिन थी उस बुक में? 187. So you have to remember क्योंकि यहाँ से भी क्वेश्चन आ सकता है. Okay. Now we'll talk about the introduction. What Dr. Kent has said about the Theridion Curasavicum. Hysterical sensitivity with extreme aggravation from the noise, motion, and exhaustion mark this remedy as unique. If the patient is coming to you and hysterical sensitiveness is there, if the word is mentioned hysterical, that means sudden changes of the mood and sudden changes of the behavior you will find because of sensitiveness, because of hyperesthesia, because of excess excitability is there. There will be a changes. And there will be aggravation because of this. There will be aggravation from the sound and motion. If you find it, then we can think about this medicine. And this was the great remedy with the old master of Scrofulosis condition. Suppose in the previous time, when the person were coming and they were suffering from the Scrofulosis condition, this medicine was acting very nicely. And this is said by Dr. James Tyler Kent, and he is mentioned in his book, Lectures on Homeopathic Materia Medica. And this medicine, we can also think if there is a necrosis of the bone is there, then again we can think. And we will find there is a nausea. Why there is any sound is there? That sound produces a nausea. Why? Because this point we can correlate with the anatomy, where the patient is having a nausea, and if we will talk about the anatomically, vomiting location in the brain में क्या लोकेशन होता है? वोमिटिंग सेंटर जो होता है मेडुला ऑब्लोंगेटा, and medulla oblongata is supplied by the cranial nerves 9, 10, 11, glossopharyngeal, vagus, and hypoglossal. And if that nerve is getting affected, that will produces a nausea. That's why this patient is having a nausea, which is mentioned in the Theridion Curasavicum, because of sensitiveness, because of hyperesthesia, because of excess excitability is there. Okay, so this is the introduction, which is said by Dr. James Tyler Kent. But what John Henry Clark has said, John Henry Clark has said in his book, the name of the book is Dictionary of Materia Medica. He said that this is also called orange spider. Why? As it thrives mostly in the orange tree. Thrives means this is developing or growing over the orange tree. That's why this medicine is commonly known as orange tree. And this is looking like an orange color. You can see why this Theridion is known as a orange spider. Orange spider. Why this is known as orange spider? Because this is thrives over the orange tree. It is a growing or developing over the orange tree. That's why the name has been kept orange spider. And this is for the first time, which is proved in 1832. Okay. 1832 में ये मेडिसिन को प्रूव की गई थी. Okay. And who has proved this medicine? This medicine is proved by Dr. Constantine Herring. C. Herring has proved. Okay. So we have to keep in mind. Sometimes there will be a question. क्या question आता है? Who has proved this medicine? So Herring has proved. When this medicine was proved? 1832, कई बार क्वेश्चन आएगा ये. Okay, and this medicine is commonly known as orange spider. So just try to remember this medicine. And this medicine spider is found especially in the West Indies, in the island of Curacao. Okay, so just try to remember this line for the information. Okay. Now we'll talk about, okay, we were talking about the herring, and we were talking about this medicine is proved 1832. This point I want to correlate with the repertory. Okay, like you guys have read in the fourth BHMS. So can anyone tell me which repertory came in 1832? Can anyone tell?
Repertory of
Repertory of
anti-psoriatic.
Yes, repertory of antisoric. Very good. Excellent. Repertory of antisoric is came in 1802. कई बार repertory portion से क्वेश्चन आता है, क्यू पॉइंट है ये. ओके, दिस इज अ क्यू पॉइंट. क्यू पॉइंट मींस क्वेश्चन आता है. ओके, कि 1832 में कौन सी रिपर्टरी आई. रिपर्टरी ऑफ एंटीसोरिक केम इन 1832. और कौन सा मेडिसिन प्रूव हुआ? तो थेरिडियन इज द मेडिसिन विच इज प्रूव इन 1832. Okay, who has proved? Who is the prover of this medicine? Constantine Herring. Okay, but again I want to correlate this Herring. Herring has also published one repertory in 1838. Okay, 1838 में एक repertory Herring ने लिखा. Can anyone tell me the name of the repertory? क्या बोलते हैं उसको? First English repertory, which is given by Herring, and that is also known as Allentown Academy. कई बार क्वेश्चन आता है Allentown Academy. Allentown Academy अगर आएगा तो नाम याद कर लेना, हेरिंग की ही बात कर रहा है. ओके, if there is mention Allentown Academy, that means we have to keep in mind they are talking about the herring. Okay, so just try to remember. Again I want to mention about this person. Okay, how many, means there are so many medicine which is proved by Dr. Constantine Herring. Can anyone tell me the name of different drugs? और क्या मेडिसिन है, कोई बताएगा?
Lachesis.
Yes, lachesis. Lachesis is there, and Crotellus horridus is there. Yes, very good. Allium cepa is also there, etc. Okay, there are so many medicine which is proved by, okay, that Herring. Okay, just keep in mind. Okay, Herring has proved Crotellus, Lachesis, Allium cepa, etc. is there. Okay, but again I want to correlate with the pharmacy point. Okay, Dr. Herring has given a potency, some scale is there like decimal, centesimal. So which scale is given by Herring? Can anyone tell? क्यू पॉइंट है, यहां से फार्मेसिस्ट क्वेश्चन आता है.
Decimal.
Yes, very good. Decimal scale which is given by Herring, but centesimal scale is given by whom?
Hahnemann, sir.
Yes, very good. Dr. Christian Frederick Samuel Hahnemann has given the centesimal potency. ये फार्मेसी से क्वेश्चन आता है, क्यू पॉइंट है ये भी. And decimal scale is given by Dr. Constantine Herring, but LM potency is given by whom? Can anyone tell? Who has given? Yes,
Jost.
yes, and 50 millismol potency, and 50 millismol potency.
Pierre Smith.
Yes,
Pierre
very good.
Smith.
Very good. Pierre Smith. Okay, Pierre Smith. Okay, if someone said LM potency का दूसरा नाम है Q potency. Okay, Q potency is given by Kunjali Jost. Okay, Kunjali Jost, and that is Rudolf Fleury. Okay, Rudolf Fleury ने ये दिया है, ठीक है. इस पॉइंट को एक बार चेक कर लेना, ठीक है. Rudolf Fleury is given LM potency. Just try to remember these are the Q points. And this medicine, Theridion, is the medicine which is belonging to the spider group of medicine. And this medicine is prepared under class 4. Sometimes you will get question from there related with the pharmacy. Pharmacy से question आता है. Theridion, Curasavicum is prepared under which class? So answer will be class 4. And why this medicine is known as orange spider? Tell me. I told you, na? Tell me. Because this orange spider is thrives over the orange trees. क्या होता है thrives का मतलब develop or growing over the orange tree. That's why the name has been kept orange spider. And this medicine is proven in 1832. I told because someone came late. Okay. Okay. Now we'll start with the symptoms. Time passes too quickly. Okay, if the someone is going or doing any work, like suppose if you are sitting in the exam room, we will think that oh कितना जल्दी टाइम पास हो रहा है, अरे अभी 3 hours का क्वेश्चन है, इतना जल्दी 2 hours हो गया. The patient will be thinking. Then we can think about two remedies is there. Can anyone tell? दूसरा रेमेडी कौन सा है?
Oculus.
Yes, very good, Hina. Excellent. That is coculus indicus, where there is means that time passes too quickly. But if the person is coming to you and that person is saying that, अरे यार टाइम ही पास नहीं हो रहा है, कितना घंटा हो गया, he is waiting only 5 to 10 minutes and he is saying टाइम पास नहीं हो रहा है, इतना ज्यादा टाइम लग रहा है. So there are so many medicine. Can anyone tell me the name of medicine? Time passes too slowly. What are the other medicine?
Argentum, Argentum
Cannabis
nitricum.
indica.
Yes, very good. Argentum nitricum, very good. And
Cannabis indica. Medorrhinum.
yes, very good, Nandi, very good. Cannabis indica, Medorrhinum, and alumina is
Nux
there.
moscata.
Next, Mosata is also there. Very good, Aryan. Next, Mosata is also there. Argentum nitricum, Medorrhinum, and Cannabis indica is there. These are the medicine where the person is thinking that time passes too slowly. And we can think about this medicine, especially when the person is closing the eyes, he will be feeling like a vertigo. चक्कर आ रहा है, चक्कर आ रहा है. When the patient is closing the eyes, the patient is feeling चक्कर आ रहा है. Then we can think about this medicine. And in the bracket, there are so many medicine. Can anyone tell? Can anyone tell? Which medicine?
Lachesis and thuja.
Yes, very good. Excellent. That is lachesis and thuja. But what is the difference between the three medicine? Actually, this medicine is having a vertigo while closing the eyes. Along with that, if you're finding the sensitiveness, then only we can think about the Theridion, Curasavicum. But when we will think about the lachesis is also having what I go while closing the eyes. But we have to find out certain intolerance should be there, desire for shower should be there. We have to find it. If you're finding this symptom, then we can think about lachesis muta. This is also known as surukuku. Okay. Another like thuja is there. Thuja we will think what I go while closing the eyes, but we should find out the fixed idea should be there. Desire for onion should be there. If you're finding this symptom, then only we can think about the thuja. This is the basic difference. But if someone is closing is the eyes, so there will be a symptoms like Theridion, thuja, and lachesis is there. But if the person is opening eyes there, then the person is having a vertigo. So can anyone tell me the name of medicine? आँख खोलने से उसको vertigo होता है. Yes, tabacum is the
Tobacco.
medicine. Very good. But if someone is looking upward, लग रहा है कि 8th फ्लोर को बिल्डिंग को देख रहा है, हॉस्टल में हॉस्टल के नीचे खड़ा है, अगर ऊपर की तरफ देखता है, so the person is having a vertigo. So can anyone tell me the name of medicine? Looking upward.
Pulsatilla and Silesia.
Yes, very good. Pulsatilla and Silesia is there. Okay. And this what I go from even the least noise or oral or labyrinthine is there or Meniere's disease is there. Okay. So we can think if the person is suffering from the Meniere's disease. Meniere's disease means what? Where there will be a first involvement of the one ear, again involvement of the another ear, and that will causing the vertigo to the patient. Then only we can think about this Theridion Curasavicum. Okay. But if the person is coming to you and that person is suffering from the ear problem, so there will we will correlate with the ENT. Okay. So there will be performing two tests. Can anyone tell me the name of a test? क्या टेस्ट करते हैं?
Weber test and Rene test.
Yes, very good. I think this year question has been asked from the Rene and Weber test. Okay. in Rene test and Weber test. Okay. In Rene, you will find AC is greater than BC. Means air conduction is more better than bone conduction. Okay. So there will be a performing two tests. One is Rene test, another is Weber test. Okay. Just try to remember. Okay. Okay. There is mentioned vertigo. Okay. This vertigo we can correlate with the Kent repertory. And for the first time, the Kent repertory was published in which year? Can anyone tell? कौन से ईयर में केंट रिपर्टरी पहले आई थी? यहाँ पे कोरिलेट करते हैं रिपर्टरी से.
1897.
Yes, very good. 1897. सेकेंड एडिशन कब आई थी?
1908.
1908. थर्ड कब आई थी?
1924.
Yes, 1924. And fourth कब आई? 35, 45 and 57 and 61 and the last one 74. And this 57 is known as Chicago edition. Okay, American edition we can also say. And this 61 is Indian edition is known as, okay, Kent Indian edition. And this 74 is the final edition. Okay. Okay, so just try to remember the year of publication of a Kent repertory. And this Kent repertory is containing 37 chapter. क्यों पॉइंट है? क्वेश्चन पॉइंट है. कितने चैप्टर है केंट रिपर्टरी में? ये भी क्वेश्चन आता है. 37, which is starting from the mind and ending with the generalities chapter. So under which chapter we will find the vertigo? Can anyone tell?
Vertigo is a different chapter.
Yes, very good. Vertigo is a separate chapter which is mentioned in the Kent repertory. Okay, but if there is a rubric which is related rubric, so rubric is related with the reeling. Okay, ये separate chapter है, लेकिन अगर rubric आता है तो reeling आता है. Okay, just try to remember. Very good. Another symptom is there headache when beginning to move as of a dull heavy pressure behind eyes, violent dip in the brain, aggravation, lying down very much, and aggravation from the others walking on the floor or least motion of the head. This patient is having a headache, you can see. And if someone is moving, it is also causing headache to the patient. Why? Because I have already said hysterical sensitivity is there. What Dr. James Tyler Kent has said in his books, Lectures on Homeopathic Materia Medica, and that was published in 1904, containing 187 medicine. Dr. Kent has said hysterical sensitiveness is there, extreme aggravation from the sound. If the person is walking, and that will causing the sound, and that will causing aggravation of the symptom, because hyperesthesia is there, because of excessive excitability is there. That's why this patient is having aggravation. Even the someone is walking on the floor, लग रहा है तुम्हें हेडेक हो रहा है, कोई दोस्त भी अगर सामने से जा रहा है, वॉक कर रहा है, टिक 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 टिक, सॉरी सर दर्द हो रहा है, डोंट वॉक ओवर द फ्लोर, डोंट वॉक, because I am having a headache, and this patient is Theridion Curasavicum. Just try to remember. Okay, तो इसमें क्वेश्चन कई बार आता है, ब्रेक करके भी आता है. कैसे क्वेश्चन आता है? पूरा लाइन भी दे दिया. ओके, कई बार होता है हेडेक व्हेन बिगिनिंग टू मूव, यहां से दिया और यहां तक दिया. ओके, यहां से भी व्हेन बिगिनिंग टू मूव एज ऑफ अ डल प्रेशर बिहाइंड द आईज. तो ये एक क्वेश्चन हो गया. अनदर क्वेश्चन क्या हो सकता है? हेडेक very much aggravation from others walking on the floor or from least motion. यहां से अगला लाइन. तो we have to remember each line full stop. Okay, and even the medicine mentioned in the bracket we have to keep in mind, because कई बार होता है ब्रैकेट वाली मेडिसिन पूछ देते हैं. Okay, so just try to remember. But if you are talking about the headache, and if the person is coming to you and the person is having a headache which is alternating with a lumbago, so which medicine we can think? Can anyone tell? Headache across the forehead and which is alternating with the lumbago. क्या होगा? फोरहेड पे होगा, एंड फोरहेड पे ऐसे अक्रॉस होता है, कई बार इधर इधर होगा, अक्रॉस द फोरहेड एंड अल्टरनेटिंग विद द लंबेगो. कई बार होता है उसको कमर में दर्द, लंबेगो भी होगा. ओके, कैन एनीवन टेल द नेम ऑफ मेडिसिन?
Hello.
Aloesocratina. Okay, Aloesocratina is the medicine. Okay, just try to remember. Okay. Another symptom, nausea from least motion and especially closing the eyes from fast riding in a carriage. I have already told why this Theridion is having nausea, because I have already told nausea and vomiting. Vomiting center, especially in the brain, is medulla oblongata, and medulla oblongata is supplied by cranial nerves 9, 10, 11, and this nerve is getting affected because of sensitiveness. It will affect, it will excite to the medulla oblongata, and that will causing nausea and vomiting. क्या होता है, excite कर देगा medulla oblongata को, तो क्या होगा, उल्टे. The patient is feeling like vomiting. Okay, that's why this patient is having vomiting. And this carriage writing, again we can correlate with the Kent repertory. Okay, nausea and vomiting while carriage riding, where we will find, under which chapter? Can anyone tell? कहाँ पे मिलेगा Kent repertory
Stomach.
में? Yes, very good,
Stomach.
excellent. Stomach is the chapter. Okay, कई बार क्वेश्चन आता है repertory portion से. Okay, nausea from carriage riding. So where we will find, under which chapter? Stomach is the answer. Okay, just try to remember. But if you are talking about the carriage riding aggravation is there, we will find there are medicine in the Materia Medica. So can anyone tell me the different medicine for aggravation from the carriage riding? क्या क्या medicine है?
Calculus.
Yes, Cocculus is there, very good, and lysine is there. Okay, and Nux mosciata is also there. In Nux mosciata, you will find backache from the carriage riding. This symptom is mentioned in the Nux mosciata, and this Nux mosciata is also known as nutmeg. Na say nutmeg, na say Nux mosciata. Okay, means N से क्या होगा, nutmeg, and N से क्या होगा, Nux mosciata. Just try to remember. And this Nux mosciata is belonging to the Myristicaceae family. यहाँ से भी एक क्वेश्चन याद कर लो, ठीक है, कि Nux vomica का दूसरा नाम nutmeg है, and this is belonging to the Myristicaceae family. Don't get confused. Another symptoms, every sound seems to penetrate the through whole body, causing nausea and vomiting. Why the sound is producing? Because of termini of the nerve is involving, like tarantula, what I have already told in the previous class, that this is belonging to the spider group, like Tarantula hispanica, and if there is involvement of the termini of the nerves, that will causing the pain in the body, and it will also causing a nausea and vertigo because of sensitiveness, because of excessive excitability, because of hyperesthesia. This will be having the complaint to the patient. Okay, and if we will talk about the discharge, we will find a chronic nasal discharge, thick yellow green offensive. Okay, if the patient is coming to and that patient is having a chronic chronic nasal discharge is there, but if we will talk about the color, there will be a green color discharge will be there, green color. Okay, green color discharge is there, and in the bracket we will find two medicine is there. Can anyone tell क्या क्या medicine है? One is
Uta.
pulsatilla. Yes, very good, Aryan. Pulsatilla and thuja, and natropsulf is also there. Very good. So what is the basic difference between this medicine when we will think about this Theridion, when we will think about the pulsatilla and thuja and natrum sulf? Let me clear. Okay, first we will talk about the natrum sulf. Natrum sulf is having a greenish yellow discharge you will find, but there will be a patient while coughing, he will put the hand over the chest, he will support the chest while coughing. This is the characteristic feature. If you are finding with greenish discharge, then we will think about only natrum sulf. Okay, okay. And when we will think about pulsatilla, if the pulsatilla is having a chronic yellow discharge is there, but there should be a thirstlessness, there will be a less thirst is there, thirstlessness you will find in pulsatilla, and weeping disposition is there, then we can think about this medicine. Okay, but when we will think about the thuja is having a chronic nasal discharge is there, yellow color, greenish discharge, which is offensive, but we have to find the Fixed idea should be there. Desire for the onion should be there. If you are finding, then only we can think about the thuja. So this is the basic difference between this medicine. Okay. Another symptom, toothache. Every shrill sound penetrates the tooth. You can see if the person is suffering from the toothache and sound is causing aggravation of the tooth, then only we can think about this medicine. But if you are talking about the toothache, this will correlate with the another medicine. Toothache feels better if anything taken ice cold. Okay. If the patient is drinking a cold water, the patient is feeling much better, especially in case of a toothache. जैसे टूथेक होता है उसको ठंडा पानी पिला दो, कितना आराम लग रहा, कितना आराम, I am feeling much better. So can anyone tell me the different medicine? What are the medicine for this symptom?
Coffea cruda.
Yes, Coffea cruda is there. There are so many medicine. Tell me. Coffea cruda is there.
Bismuth causticum.
Yes, very good, Aryan. And natron sulf is there. Prinia is there. Natron sulf is there. Sepia is also there, where the patient is getting relief by drinking cold water. But suppose if the person is having a toothache and that patient is getting amelioration from the warm water, then which medicine? Warm drinks से उसको आराम मिलेगा. Which medicine we will think? Then only yes, very good, Hina. Excellent. Macphos and arsenic album we will think. Okay. But if you're talking about the warm drinks, this point I am correlating with the another medicine. Don't get confused. Desire for very hot drinks. Which medicine? Can anyone tell? Desire for very hot drinks. Can anyone tell? Desire for very hot drink. Yes, very good. Chelidonium and
Castanea vesca, Cascavella, Lycopodium, arsenic.
Very good, excellent. Okay, there are so many medicines. Chelidonium is there, arsenic album is there, Cascavella is there. Okay, and Castanea vesca is the medicine where we will find there is a desire for hot drinks. Okay, but if there is another patient who is having a dread of a hot drinks, mummy garam pani chahiye, mummy I don't like, because this patient is having a so much dread of a hot drinks. Can anyone tell me the name of medicine? Date of very hot drinks. गर्म पानी देखते ही उसको बहुत डर लगता है. Can anyone tell?
Kali sulf.
Yes, very good. Excellent, Hina. That is Kali sulf. Very good. Excellent. Okay, but these symptoms again I want to correlate with the another medicine. Toothache as if anything warm taken into the mouth. Which medicine? Can anyone tell? This is a single medicine, single symptoms, a single line is mentioned in the Materia Medica. Tell me, which medicine? Toothache as if.
Chamomilla.
Yes, very good, brain. Excellent. Chamomilla is the medicine. But this symptoms again I want to correlate with another medicine. Toothache as if a toothache when nursing the child. Which medicine? Toothache when nursing the child. Which medicine?
China.
Yes, very good. China is the medicine when toothache nursing the child. Excellent. Very good. This link will be over. Again, you have to join the same link without any delay. Okay. Okay. Noise seems to strike on painful spot over the body. Suppose if the patient is coming to you and if you are finding this patient is having a spot. Okay, you can see there is a spot and there is a so much pain. Then we can think about only this medicine, and this medicine is also having a luminous vibration. थोड़ा भी अगर light भी कहीं bright light is there, so it will causing aggravation of the symptom you will find. And when there is a sensitive to light, because this is medicine is having a hypersensitivity, hyperesthesia is there, excessive excitability. Because of that, this patient is having a problem from the bright light. Luminous मतलब ब्राइट लाइट से भी इसको प्रॉब्लम होता है, बिफोर आइज एंड सेंसिटिव टू द लाइट. ओके, जस्ट ट्राई टू रिमेंबर. Nausea and vomiting when closing the eyes on motion. You can see in the picture, if the patient is closing the eyes, this patient is having a vomiting feeling. Vomiting feeling means the patient is feeling nausea is there. If nausea is there while closing the eyes, while motion is there, when the patient is walking, then the patient is feeling ulti jaisa lag raha, ulti jaisa lag raha. Then we can think about this medicine, Theridion, Curasavicum. Okay, but this nausea I want to correlate with the another medicine in the Materia Medica. There is mentioned could only vomit. I feel much better if I could vomit. This line is mentioned in the Materia Medica. The medicine is Nux vomica. So what he will do? Nausea feeling. He will put the fingers into the mouth and he will try to vomit. Oh, oh. The patient will be putting the finger into the mouth and he will try to vomit. Why? Because once the patient will vomit out, he will feel sorry. Now I am feeling better. मम्मी मैं उल्टी हो गया ना, अब अच्छा लग रहा है. Now this medicine we can think Nux vomica. But if the nausea is there, constant nausea with clean tongue is there, which medicine we can think? Can anyone tell?
Ipecac.
Yes, Ipecac. Very good, Brin. Very good. Ipecac is the medicine. Very good. Pain in the left floating ribs. Okay, suppose if the patient is coming to you, and this point I want to correlate with the anatomy. Okay, if the patient is coming to you and that patient is having a pain, especially left-sided floating ribs, okay, then only we can think about this medicine. Okay, but can anyone tell me floating ribs कौन कौन सी होती है एनाटॉमी से कोरिलेट करके बताओ. Yes, tell me.
11, 12.
Yes, 11 12 कई बार एनाटॉमी से क्वेश्चन आता है फ्लोटिंग रिब्स कौन कौन सी होती है. सो this is 11 and 12, that is a floating ribs. Okay, but if there will be a pain especially in the third ribs only, so can anyone tell me the name of medicine? थर्ड रिब में पेन होगा, थर्ड रिब, थर्ड रिब में पेन होगा, which medicine? Elysium metallicum is there. Elysium metallicum is the medicine. If the patient is coming to you and he is explaining pain especially in the third rib, then only we can think about Elysium metallicum is the medicine. Okay, don't get confused, just try to remember. Okay, कई बार आता है question. Okay, and this was the question I think has been asked 5 years ago in the AIAPGET. Okay, in 2019, like. Okay, and cardiac anxiety and pain is there. Okay, because this like if the patient is coming to you and that patient is having a cardiac anxiety and pain, why this Theridion is having cardiac anxiety and pain? Because this, if you are talking about the spider group action is especially over the nervous system, and that nervous system will lead to the cardiac pain when the patient has. So I was explaining that why this patient is having a cardiac or chest pain, because this patient, I have already told, this medicine is belonging to the spider group like Theridion, and Dr. James Tyler Kent and like Vitholkas, he said in his book, the name of the book is Essence of Materia Medica. He said that especially this spider group is having action over the nervous system, and if there is a person is suffering from the nervous affection or nervous is there or anxiety is there, so what will happen? If he will be thinking or sad will be there, so heart will be action more. Okay, heart function क्या होगा, ज्यादा होगा, so that will causing pain especially into the chest. Okay, and if the patient is having because of nervous complaint, because of sadness, because of melancholy, if the patient is having a chest pain, then only we can think about this medicine Theridion Curasavicum. But these symptoms I want to correlate with another medicine. If there is a palpitation from mental exertion, which medicine we can think? Palpitation from mental exertion.
Area Rs.
Yes, very good. Palpitation from mental exertion. Very good. Excellent. Mental exertion. So just try to remember this line. Calcarea ars is the medicine. Very good, excellent. Okay, another symptom is there what I have already discussed, pain in upper left chest. Okay, you can see in the picture what causes chest pain, like there is a pericarditis is there, angina is there, okay, and heartburn is there, etc. Okay, these are the causes of pain, especially in the left side of the chest, okay, or in the chest. And this stinging thrust everywhere, the if you will find there is this stinging type of character, if you will find stinging type का pain होता है, then only we can think about this medicine. And throbbing over the left eye, especially left eye, you can see in the picture, if the patient is having pain especially into the left eye is having pain, okay, this eye is having a pain, then only we can think about this medicine. Pain especially in the left eye, here you can see left eye, okay. But if the having a patient is coming to you and this patient is having a headache, especially to the left eye, and there is a neuralgic like pain to the left eye, then which medicine we can think? Can anyone tell?
Ferromet.
Yes, ferrum metallicum is there. Not ferromet, sorry, not ferromet. Spigelia, yes, very good. Ferromet, we can think if the patient is coming to you with frozen shoulder, especially to the left side. Okay, if the left side frozen shoulder is there, then only think about Ferromet. So don't get confused. वो left side shoulder का दर्द है, तब हम Ferromet सोचेंगे. But if the person is coming to you and that person is having a neuralgic like pain, especially into the left eye, and the patient is feeling that my orbit is small, and feeling the eyes is too large than the orbit, then only we can think about spigelia, which is also known as pink root, and that is belonging to the Loganiaceae family. Just try to remember. Okay, in rachitis and caries, caries and necrosis, in apparently goes to the root of a evil and destroys the cause. Okay, suppose if the person is coming to you and that person is suffering from the rachitis, caries, necrosis, तो उसका जो main cause है उसको जाके ठीक कर देता है. This medicine, it will going and it will cure the root of the cause. Okay, then only we can think about Theridion, and this is said by Baruch. Dr. Baruch has said. Okay, this we have to remember. Sometimes क्या होता है क्वेश्चन, ये लाइन दे दिया and पूछेगा who has given this line. Okay, Dr. Baruch has given. In option you will find Henneman, Herring is there, Farrington is there, and Baruch is there. So answer will be Baruch. Okay, so don't get confused. Okay, and Thysis florida often affects a cure if given in the early stage of a disease. Thysis florida क्या है? Can anyone tell? Thysis florida, can anyone tell?
TB of chest.
Yes, very good. Thysis florida, जिसमें से thysis is pulmonary tuberculosis and florida is the place in the old time. Okay, it is place. Okay, but this time I will tell you the story. Okay, okay. Thysis florida means pulmonary tuberculosis was there in the florid place and often affects if we were prescribed, if we will prescribe in the early stage of this pulmonary tuberculosis, then we will able to cure. This is said, okay, by Gruber Herring. Okay, and this was more case was developed in the Florida. Okay, Florida was the place. Okay, but this time in 2024 there is a one person. Okay, the name of the person is Florida is there. Okay, and he has found 700 cases in 2024 of a pulmonary tuberculosis. Okay, again we can think about this medicine if we are getting the pulmonary tuberculosis case. Okay, so इस समय 2024 में पर्सन का नाम है फ्लोरिडा एंड पहले के जमाने में क्या था, वो प्लेस का नाम है फ्लोरिडा. ओके, सो डोंट गेट कंफ्यूज, जस्ट ट्राई टू रिमेंबर. एंड इन स्कोफ्लोसिस where best chosen remedy fails to relieve. Suppose if the patient is coming to you and that patient is having a Scrofulous condition is there. What I have already told in the introduction part, what Dr. Kate has said. If there is a, like, it was a remedy with a master of scrofulous condition. He was saying, if you're finding scrofulous, then only we can think about Theridion, Curasavicum. If you're finding this scrofulosis or scrofulous condition is there, then only we can think. Okay, you can think there is a inflammation, that is a rickets to the baby is there. Okay, then we can think about scrofulosis means if there is a growth, bony growth is there, or if there is a glandular inflammation is there. Okay, glandular involvement is there, then only we can think. And suppose if you have prescribed on the basis of totality of symptom, on the basis of symptom similarity, but that medicine is failed to cure, in that condition only we can think. सारी मेडिसिन हमने दे दिया on the basis of totality of symptom और सिम्टम सिमिलरिटी के बेस पे हमने कोई भी दवा दिया है और कॉन्स्टिट्यूशनल बेस पे, बट उससे आराम नहीं मिल रहा है, then only we can think about Theridion, Curasavicum. And this medicine relationship is there, follows well after Calcarea and Lycopodium. Suppose if you prescribe Calcarea and Lycopodium, then only we can think about Theridion, Curasavicum. Okay, so don't get confused. Okay, बट हियर रेकाइटिस है तो रेकाइटिस से हम रिलेटेड प्रैक्टिस ऑफ मेडिसिन में कोरिलेट कर रहा हूं. ओके, हियर विटामिन बी डिफिशियंसी इज देयर. Okay, but if the person is like baby is there, baby is suffering from the rickets of vitamin D deficiency, so what you will find in the ribs में इसको क्या मिलता है, एक फाइंडिंग rickets रोजरी बोलते हैं. ओके, rickets रोजरी कई बार क्वेश्चन आता है. ओके, rickets rosary. Okay, rickets rosary we will find in which disease, so rickets will be answer. Okay, Haberson nodule you will find in rickets rosary or rickets. Okay, rickets में क्या मिलेगा, Haberder's nodule. एक फ्रैक्चर इसमें मिलता है. कैन इनवन टेल मी द नेम ऑफ फ्रैक्चर, उस फ्रैक्चर का नाम है, कोई बताएगा? I will write with
Green
the
stick fracture.
yes, very good Hina, excellent. I have already told, very good. Green stick fracture. Okay, green stick fracture, this is a sign of fracture, we have read. Okay, this is a sign of a fracture, so green stick fracture. Green stick fracture का मतलब मैं बता दूं एग्जांपल, बंबू होता है ना, बंबू का जब जब न्यू निकलता है तो बहुत फ्लेक्सिबल होता है. एट लास्ट मोमेंट उसको फ्लेक्स करते जाओ, मोड़ते जाओ, एट लास्ट मोमेंट जैसे ऐसे फ्लेक्स करते जा रहे हो, एट लास्ट मोमेंट देयर विल बी अ ब्रेक. That is known as green streak fracture. So just try to remember, don't get confused. Okay, ये भी क्वेश्चन आता है. green stick fracture where we will find, in rickets we will find. Here necrosis has been written. This point I want to correlate with the another medicine, necrosis of lower jaw. Which medicine, can anyone tell? jaw है, ये jaw line है.
Phosphorus.
Yes, very good. Necrosis of lower jaw, the medicine is phosphorus. So I want to tell you one of my case, which is Kane. Like there is an intern who is sitting beside me. Like 2 months before, there was a case. A person came to me and he was having necrosis of lower jaw was there. Okay, then he asked, भैया क्या medicine देंगे? Okay, then I remember कि there is written necrosis of lower jaw. I said कि just prescribe phosphorus 200, and after 1 month that patient came with an improvement. I think 80 or 70% that patient has improved. Okay, so we can think about this medicine also, phosphorus, if we are finding necrosis. Okay, and this is a mnemonic. By this way we can remember the Theridion. T for tubercular diathesis is there. H for hypersensitive to noise, aggravation from the least motion. And E for extreme nausea and vomiting with vertigo, aggravation from motion. R for restless, time passes too slowly, and aggravation, inability. I for inability to close eyes, because closing eyes is causing aggravation to the vertigo. Okay. D for diathesis, Scrofulosis, I have already told, Scrofulosis and necrosis. I for intolerance to noise, because this is sensitiveness is there, hyperesthesia is there, excessive excitability is there. Okay. O for on cuffing, knee jerk to the abdomen. Okay, and N for necrosis of the bones. So just try to remember this is mnemonic to remember the Theridion. Okay, in short. Another medicine we'll read, that is Terebinth. Okay, so you can see in the picture that is Terebinth. Okay, and this is also known as oil of turpentine. Okay, this terebinth is known as oil of turpentine, and this medicine is proved by Dr. Seedale. Okay, the name of the person who has proved this medicine. यहाँ से क्वेश्चन आता है कई बार कि who has proved this medicine? Seedale is the person. Okay, Seedale is the person who has proved this medicine. So how you will remember? Short करके याद रख लेना. Short याद रखो या toss याद रखो. Okay, short. Okay. Short याद रखना. S for Seedale, O for oil of turpentine, and T for terebinth. Okay, okay. So, and this medicine is prepared under class 6th B. Okay, just try to remember. 3 class and 3 का डबल कितना हो गया? देखो ये 3 वर्ड है. 3 का डबल कितना हो गया? 6 और 6B में ये prepared होता है. Just try to remember. Okay. Now we'll talk about the symptoms of this terebinth. Tongue is smooth, glossy red, as if deprived of papilla, as if glazed, elevated papilla coating peels off in patches, leaving bright red spot or entire coating cleans off suddenly. In eczema and dry and red and burning in the teeth. Suppose if the patient is coming to you and this type tongue, if you're finding, okay, if you're finding this type of tongue, then only we can think about this medicine. Okay, and if you're finding there is a tip of tongue, if burning is there, then one can think about this medicine. But if you're talking about the tongue character, okay, so I want to correlate with the few medicine. Okay, suppose if the patient is coming to you and that patient is having a strawberry tongue. Okay, strawberry tongue is there. Okay, so which medicine we can think? Can anyone tell? Strawberry tongue. This is strawberry tongue.
Belladonna.
Yes, very good, Aryan. Very good. Excellent. Belladonna and there are many more medicine.
Basilinum,
Yes, very good. Basilinum is there. Belladonna.
Progeria,
Yes, Frageria. Frageria is also there. There are 3 medicine where we will find strawberry tongue. Okay. Belladonna, Belladonna, Basilinum, and Frageria is the medicine which we will find in Borychmetria medica. Okay. So we can think. But if you're finding strawberry tongue, this strawberry we can correlate with the disease condition. Okay. स्ट्रॉबेरी टंग किस डिजीज में मिलता है? इन विच डिजीज यू विल फाइंड स्ट्रॉबेरी टंग? कौन से बीमारी में मिलता है?
Kawasaki disease, vitamin B12 deficiency,
Yes, and one more is there. Kawasaki disease. Okay, Kawasaki is the disease condition, and vitamin B12 deficiency is there. Okay, and scarlet fever is there. Okay, स्कारलेट फीवर. यहाँ पे क्या मिलेगा? स्ट्रॉबेरी टंग. ओके, स्ट्रॉबेरी टंग. ओके, स्ट्रॉबेरी टंग. ओके, स्ट्रॉबेरी टंग. ओके, मेडिसिन में पूछा जाएगा तो बेलाडोना एंड बेसिलिनम एंड फ्रेजेरिया इज देयर. बट इफ देयर इज अ डिजीज तो कावासाकी. कई बार आता है क्वेश्चन. You will find question in AIAPGET and UPSC and UPPSC also. Kawasaki disease. Strawberry tongue, you will find in which disease? Kawasaki disease, vitamin B12 and scarlet fever is there. But again, I want to correlate. Okay. If there is a strawberry gum is there. Strawberry gum, which disease?
Wegener's granulomatosis.
Very good, very good. Okay, very good, excellent, Brinth. Okay, strawberry गम इज देयर. ओके, तो ये कहाँ पे मिलेगा? वेगनर में मिलेगा. ओके, वेगनर ग्रेनुलोमेटोसिस. ओके, ग्रेनुलोमेटोसिस. ओके, जस्ट ट्राई टू रिमेम्बर. बट इफ देयर इज अ स्ट्रॉबेरी गॉल ब्लैडर इज देयर, सो व्हाट कैन बी द डिजीज कंडीशन? गॉल ब्लैडर अगर हो रहा है स्ट्रॉबेरी की तरह तो क्या बोलेंगे उसको? व्हाट कैन बी द डिजीज कंडीशन? Cholesterosis is the disease condition. Okay, that is known as strawberry gallbladder. But if there is a strawberry vagina is there, So what can be the disease condition? Strawberry vagina.
Trichomonas.
Yes, very good. Trichomonas vaginalis. This is known as strawberry vagina. Don't get confused, just try to remember. Okay. Abdomen extremely sensitive to touch. Distension, flatulence, excessive tympanitis, and meteorism is there. Okay. So, suppose if the patient is coming to you and if you're finding abdominal distension is there, okay, then we can think about this medicine. But we have read in the surgery like 5F is there, fair, fatty, flabby is there, and flabbiness is there, okay, and fecal matter is there that will causing the distended abdomen. Okay, just try to remember. Okay, and that is mentioned meteorism. Meteorism means abdominal distension. Okay, and if you are finding this type of symptom, along with that, if you're finding sensitiveness, then we can think about this medicine. Okay. Okay. But if there is a abdomen distended is there, if acidity is there in the abdomen, then which medicine we can think? Distended abdomen is there and acidity is there. Which medicine? China is there. Okay. But if the person is having abdomen distended, but erection is getting providing relief to the patient, which medicine?
Carbohydrate.
Yes.
Carbohydrate.
If the patient is coming to you and that patient, oh, oh, now I'm feeling, now এখন খুব ভালো লাগছে, इतना अच्छा लग रहा है, इतना अच्छा लग रहा है, डकार डॉक्टर बाबू যখন উঠে অনেক ভালো লাগে, इतना अच्छा लगता है जब ज्यादा डकार आता है. But if the patient is passing flatus and he is getting relief, which medicine we will think? Lycopodium.
Lycopodium.
Yes, L for lower, lower मतलब नीचे से पास होगा. L for lower, L for lyco. Don't get confused. Okay. Very good, excellent. Diarrhea, stool, watery greenish mucus, frequent profuse, fetid, bloody, burning in the anus and rectum, fainting, exhaustion after. Okay. Diarrhea, according to the community medicine, what is diarrhea? If the person is coming to you and that person is having a watery passing of a loose stool 4 to 5 times in a day, that condition is known as diarrhea. And if the person is passing a white and greenish color of stool is there or bloody type, then only we can think about this medicine, and it will causing so much burning in the rectum. And if the person is having a diarrhea, so there will be a problem which is really related with the dehydration. अब डिहाइड्रेशन होगा तो डिहाइड्रेशन क्या होगा? बॉडी वीक होगा. बॉडी वीक होगा तो क्या होगा? पर्सन फेंट हो जाएगा, गिर जाएगा. ओके, he will fall down, he will faint after the exhaustion. Why? Because of diarrhea, because of prostration. This patient will be fainting after exhaustion. Then we can think about this medicine. But if you're talking about the exhaustion, this exhaustion word we can correlate with another medicine like arsenic album. Arsenic album is the exhaustion. Exhaustion is not felt by the patient, especially when lying down. जब तक बेड पे लेटा है, ओ क्या मजा है, मोबाइल चला रहा है, रील देख रहा है. ओके, but once the patient is trying to move from the bed, oh, I'm feeling so much weakness, मम्मा पड़े जाबो, मम्मा गिर जाऊंगा, वो लेट जाएगा फिर से. When the patient is trying to move from the bed, then only he will feel that weakness is much more marked. There is mentioned great prostration with rapid sinking of the vital force. This is written in the first line of the arsenic. So only we can think about arsenic if there is desire for the cold things also. Okay. So this is the comparison. Okay. Another symptom, worms with foul breath, choking, dry hacking cough, tickling at anus, ascarids, lumbricae, tapeworm, segments passed. You can see in the picture. Like बचपन में कई बार होता है ना, हम लोग पोटी करते, पोटी के साथ ही निकल जाता है, कीड़ा निकलता है, उस समय तो डर जाते हैं, क्या है, अब पता चलता है राउंड वर्म है, टैपवर्म है, अब पता चलता है, उस समय तो डर जाता है, अरे ये क्या निकल रहा है. ठीक है. So only we can think if the person is having a worms in a stool, along with that if you're finding a foul breath, then we can think about this medicine. Okay. And there are different medicine for these symptoms. और क्या क्या मेडिसिन है?
Sina.
यस, सीना इज देयर, वेरी गुड आर्यन। स्पाइजेलिया इज देयर, वेरी गुड। और कोई बताए और क्या मेडिसिन है? देयर आर सो मेनी मेडिसिन।
Thymol, amelioride.
यस, थाइमोल, वेरी गुड, एक्सीलेंट हिना। थाइमोल एंड
Eucrium verum.
yes, TMB is there, very good, and Santonin is there, very good, and मेल फन रूट, हैनमन ने ये यूज किया है मेल फन रूट का। और दूसरा क्या नाम है? कैन एनीवन टेल? मेल फन रूट।
Good evening, ma'am.
Philic mass, okay, Felix mass is there, okay, Felix mass is there, okay, Felix mass is there. So I want to tell you, like someone told, like Hina told, Imbelia rice. Imbelia rice is the medicine which is mentioned in the Drugs of Hindustan. The name of the book is Drugs of Hindustan, and that is written by N.C. Ghosh. N.C. Ghosh is S.C. Ghosh. Sorry, S.C. Ghosh is the person. S.C. Ghosh. Wait. Yeah. Okay. S.C. Ghosh is the person who has written Drugs of Hindustan. Name of the book is Drugs of Hindustan. कई बार ये क्वेश्चन आता है, ठीक है? Drugs of Hindustan is written by whom? So answer will be S.C. Ghosh. And Drugs of India, that is known as that is written by N.C. Chatterjee. Drugs of India, N.C. Chatterjee ने लिखा है, S.C. Ghosh Drugs of Hindustan लिखा है. And in Drugs of Hindustan, S.C. Ghosh has mentioned about the Imbelia ripes. Okay, so what is the symptom of Imbelia ripes? So when we will think about the Imbelia ripes, okay, Imbelia ripes, okay, when we will think. Imbelia ripes, suppose if the patient is coming with a complaint of a worms, patient को worms बहुत है, and he has taken Nux vomica, Spisalia and Sina. The patient is not getting cured. बट द पेशेंट इज टेलिंग, डॉक्टर साहब मैं जितना पुट्टी करता हूं उसमें ज्यादा तो कीड़ा होता है, स्टूल तो कम होता है। मिस इफ द पेशेंट इज कमिंग टू एंड दैट पेशेंट इज एक्सप्लेनिंग दैट आई एम पासिंग मोर वॉर्म्स देन स्टूल, मतलब 1 kg worms पास कर रहा है और 50 ग्राम stool, then only we can think about the medicine Imbelia ripes. This is the indication of Imbelia ripes. Without this you cannot prescribe this medicine. We have to keep in mind Imbelia ripes. If you want to prescribe, you have to find more worms in the stool than stool. Okay, क्या होता है? worms ज्यादा होना चाहिए, stool कम होना चाहिए। 1 kilo worms है तो स्टूल बहुत कम होगा, लिटिल अमाउंट, तुमको स्टूल दिखेगा ही नहीं। वाई? बिकॉज दैट इज कवर्ड बाय द worms. worms की क्वांटिटी इतनी ज्यादा होगी कि स्टूल दिखेगा ही नहीं। एंड इफ यू आर फाइंडिंग दिस सिम्टम, देन ओनली वी कैन थिंक अबाउट this Imbelia ripes and it will work. Okay, we have to keep in mind. Okay, and thymol is there. In thymol, what is mentioned? Specific for the hookworm. Okay, another medicine is also there. Thallium metallicum is there. Thallium metallicum is the medicine. We can think about worms. Worms के लिए ये भी हम सोच सकते हैं. Okay, so there are so many medicine we have already discussed. Okay, another symptom, hematuria, blood through thoroughly mixed with a urine sediment like a coffee grounds, cloudy, smoky, albuminous, profuse, dark and black, painless. Okay, suppose if the patient is coming to you, hematuria means if the person is passing urine mixed with the urine, urine pass कर रहा है लेकिन साथ में blood भी आ रहा है, that condition is known as hematuria. But if you are talking about the hematuria, then we can talk about the many more medicine. और क्या क्या medicine है hematuria के लिए? Can anyone tell? Can anyone tell? There are so many medicine. Ledampal is there, Cantheris is there, Maxol is there, Sarsaparilla is there. Okay, etc. There are so many medicine, but there is mentioned albuminous. Okay, albuminous. Suppose if the patient is coming to you and that patient is having a albuminous, albuminuria during during pregnancy, acute or chronic, and weakness is there, then which medicine we can think? We have correlated with another drug. Drug का नाम बताओ. Helonius is the drug. Okay, Helonius is drug. Okay, so we can think about this medicine, and phosphorus is also there if there is a albuminuria. Okay, then we can think, but there is a written black color of urine. Okay, this black we can correlate with the disease condition. Okay, suppose if the patient is coming to you and that patient is having a brownish black color of urine, then which disease condition we can think? We can correlate with the pathology. Just try to remember, we are correlating with the pathology subject. Okay, brownish black कौन सा मेडिसिन है? कौन सा? Yes, very good. Brownish black, if you're finding, then we can think about the disease condition is alkaptonuria. Just try to remember. बेबी याद कर लो. ओके, इस ई को भूल जाना लेकिन बेबी को याद रखना. ओके, बेबी, बी फॉर brownish, A for alkaptonuria, and B for black. ओके, ब्राउनिश और ब्लैक के बीच में ये बेबी बेचारा ए एल्केप्टोन्यूरिया दब गया है. ठीक है, बेबी के बीच में दब गया है. ओके, सो जस्ट ट्राई टू रिमेंबर. ओके, बेबी. ओके, बट इफ हियर मेंशन ब्लैक, but suppose if you're finding a blue color or inky color of urine, then can anyone tell me the name of a drug? Which medicine?
Called CULCUTA.
Yes, very good, very good, excellent. That is a colchicum nail is the medicine. Very good, Aryan. Another symptoms, purpura hemorrhage ka fresh ecchymosis in great numbers of from day to day. Suppose if the patient is coming to you and if you're finding this type of symptom, then we can think, and these symptoms we can also correlate with the sulfuric acid, which is also known as H2SO4, and which is also known as oil of vitriol, which is causing the permanent disfiguration of the skin. That's why this is known as oil of vitriol. That's why this is known as तेजाब. इसको तेजाब भी कहते हैं, हमने पढ़ाया है इसको प्रीवियस क्लास में. याद रखना, कई बार आता है क्वेश्चन. ऑयल ऑफ विट्रोल इज नोन एज सल्फ्यूरिक एसिड. ओके, okay, so just try to remember, and we will find purpura hemorrhage especially in case of a sulfuric acid, but there will be a changes of the skin, especially if you are finding green color of skin or red, then we can think about this sulfuric acid. Okay, ascites with anasarca in organic lesion, kidney disease, and dropsy after scarlatina. Suppose if the patient is coming to you and that patient is suffering from the ascites. What is ascites? If there is accumulation of the peritoneal fluid, okay, in the peritoneal cavity, okay, then we can think about this ascites. We will say ascites, okay. But if there is a generalized collection of the fluid, that is called anasarca. Okay, anasarca के साथ अगर thirstlet होगा, then we can think about apis. Okay, but apis we can think anasarca or ascites with thirstless. Okay, but if there is a ascites with thirst, then we can think about apocyinum canavinum. Okay, in the bracket you will find acetic acid is also there. Okay, and if the person is suffering from the kidney disease, then it is causing developing of the ascites, then we can think about this medicine Terebinth. And this Terebinth has the order of violet. The urine has the order of violet. Which medicine? Apart from this, Terebinth में तो है, इसके अलावा और कौन सा medicine है? The urine has the order of violet.
Thyroidinum, Copiva officinalis, and Juniperans.
Yes, very good, excellent. Copiva officinalis and Juniperus is there. Very good, and Thyroidinum. Okay, these are the three medicine we have to keep in mind. Okay, and Terebinth is also there. Thyroidinum, Copiva officinalis, Juniperus. Okay, just try to remember. कई बार आता है question. Ascites, these are the ascites. Okay, accumulation of the fluid in the abdominal cavity or peritoneal cavity. Okay, what can be the cause? Like we can correlate with the practice of medicine. Okay, so these are the causes. Liver cirrhosis is there, cancer, heart failure, kidney disease, pancreatitis, hypothyroidism. Okay, and this is the sign. Weight gain will be there, shortness of breath will be there, abdominal distension, nausea, vomiting, and loss of appetite. Okay, just try to remember. Another hemorrhage from bowel with ulceration, passive dark with the ulceration with the epithelial degeneration is there. Suppose if the patient is coming to you and that patient is having a bleeding from the orifices, okay, and from the ulcer, then we can think about this medicine. I will go little fast, okay, just try to remember. Violent burning and cutting pain in the bladder. Tenesmus sensitive to hypogastrium and cystitis and retention from the atony of the fundus. Okay, if the patient is coming to you and that patient is having violent pain and cutting pain, especially in the bladder while passing the urine, and sensitiveness you will find over the right, over the hypogastrium, okay, hypogastrium region, and you will find because of fundus, atony of the fundus is there, and that is causing the retention of urine. Then we can think about this medicine. Okay, cystitis is also there. Okay, but this cystitis we can correlate with the staphyscria. In case of a staphyscria, there is a mention burning pain will be there. Patient cannot pass. So much difficulty is there while passing because honeymoon cystitis we will find in case of a staphyscria. Okay, just try to remember. And symptom of cystitis, if we correlate with the gynae, there will be a urine dark रहेगा, cloudy रहेगा, and blood urine you will find, and there will be pain in the lower abdomen. And lower abdomen में पेन है तो ये क्वेश्चन भी आया था पीआईडी से रिलेटेड, इस साल क्वेश्चन आया था, ठीक है, याद रखना, ये गायनी ऑफ से, ठीक है, पीआईडी से. ओके, एंड पेन ड्यूरिंग सेक्स दिस कंडीशन को क्या बोलते हैं? पेन ड्यूरिंग सेक्स, व्हाट वी विल से दिस कंडीशन? Dyspareunia. Very good. Dyspareunia is the condition where we will find pain if the female patient is having sexual intercourse. At that time the patient is having pain. That condition is known as dyspareunia. Albuminuria acute in early stage when blood albumin and around more than the cast and epithelium after the diphtheria, scarlatina, and okay, typhoid. Then we can think about this medicine. Okay, and if early stage if you're finding, but if later stage albuminuria is there, then we can think about the phosphorus. Okay, but if there is albuminuria especially during pregnancy, acute or chronic, and with weakness, then we can think about the halonius is the medicine. Okay, but here written cast. Okay, now we will talk about the hyaline cast. Hyaline cast is the normal. Okay, we will find from the we can correlate with the practice of medicine with excretory system. Okay, hyaline cast. Okay, ये normal भी होता है hyaline cast. Okay, but pyelonephritis में भी मिलता है. Okay, मैंने एक चार्ट बनाया है आपको दिखा देता हूँ. आरबीसी कास्ट भी होता है जो कि ग्लोमेरुलोनेफ्राइटिस में मिलता है. ओके ओके, I will tell you. This is the cast. Okay, hyaline cast you will find composition म्यूकोप्रोटीन्स होते हैं, पाइलोनेफ्राइटिस में मिलता है, सीकेडी में मिलता है, लेकिन ये नॉर्मली भी मिलता है. ओके, आरबीसी मिलेगा तो ये ग्लोमेरुलोनेफ्राइटिस. बट यहां से ग्लोमेरुलाइटिस से एक और क्वेश्चन आता है, कोला कलर्ड यूरिन. कोला कलर्ड यूरिन यू विल फाइंड इन ग्लोमेरुलोनेफ्राइटिस. कई बार ये नॉर्मली भी मिलता है. कब मिलेगा? वो प्लेट्स play the contact sport, those people who will be playing the sports. क्या होता है? There will be a rupture of the vessels, small vessel or muscle, that will causing the RBC present. Okay, that's why we will find sometimes in normally in case of a sports person. Okay, WBC है तो pyelonephritis होगा ही. Okay, and tubular interstitial disease is there, kidney injury is there, and epithelial is there, tubular and interstitial kidney injury में मिलेगा. ग्रेनुलर कास्ट एडवांस रीनल डिजीज में मिलेगा, एंड वैक्सी कास्ट भी एडवांस रीनल डिजीज. फैटी कास्ट इज देयर, वी विल फाइंड इन नेफ्रोटिक सिंड्रोम, हाइपोथायरॉयडिज्म, एंड एक्यूट किडनी डिजीज. एंड ब्रॉड कास्ट वी विल फाइंड इन किडनी. यूरिन रिच इन एल्बुमिन एंड ब्लड but few if any cast, and aggravation from the living in damp or dwellings. Okay, suppose if the patient is coming to you and if you are finding more albumin, okay, and blood, but there will be a no cost or very little. Okay, then we can think about this medicine, and that will be aggravation from the damp areas is there. Okay, and if the person is staying in the damp area, you can see in the picture. Okay, but if you're finding more protein in the urine, that we can correlate with the disease condition, like excretory system, we can correlate with the excretory system. The name of the disease is nephritic syndrome. Okay, nephritic syndrome. Okay, where you will find more protein, especially in the urine, that is known as proteinuria. Okay, just try to remember. And strangulary, spasmodic retention of urine. So much pain is there, causing intolerable pain, and retention of urine means the patient cannot finish the urine. Okay, while passing. So we can think about this medicine. Okay, has a selective affinity from bleeding mucous surface. Suppose if the patient is coming to you and if you're finding bleeding tendency there, then we can think about this medicine. And tympanitis and urinary symptoms very marked is there, like abdominal distension is there. Along with that, if you're finding urinary complaint, then only we can think about this terebinth. And unbroken chilblains is there. You can see in the picture, if you're finding there is no skin broken and chilblains is there, then we can think about this medicine. Another medicine we can also think agaricus is there, abrotinum is there, and zincum is the medicine. Okay, zincum. Okay, so just try to remember. And bright disease preceded by dropsy. The previously this term was used, bright disease, if the person is suffering from the group of a kidney disease, acute or chronic, that is known as bright disease, and that is causing dropsy to the patient. This then only we can think about this medicine, and this is said by Goulon. Okay, just try to remember the name of the person, Goulon. Okay, important. Okay, Goulon. Okay, but bright disease is also mentioned in which medicine? Can anyone tell? Materia medica में कहाँ mention है? Calibrome. Okay, Calibrome. Distalis is also there. Okay, bright disease you will find. Amblyopia from alcohol. Suppose if the person is drinking too much alcohol, and if they are drinking too much alcohol, that will causing amblyopia. Means you can see from one eye the patient. What is the meaning of amblyopia? Means from one eye the patient can looks very clearly nice. এখন খুব ভালো করে দেখতে পাচ্ছি, means এখন the patient will say एक चोखटा माने एक आंख से बहुत अच्छे से दिखाई दे रहा है, another आंख से उसको दिखाई नहीं दे रहा है. That condition is known as amblyopia, and this patient will have a history of alcohol, and this alcohol we can correlate with the Kent repertory. Okay, so under which chapter of Kent repertory we will find related rubric with the alcohol? Batao, already I have told.
Mind chapter.
Yes, mind chapter is there. Very good. Mind chapter. Mind chapter में क्या rubric है? Very good, excellent, Hina. There are two rubric.
Dipsomania and mania portu.
Very good. Dipsomania and mania is the portu. Okay, mania portu. These are the rubrics we will find in Kent repertory under the mind chapter. कई बार आता है dipsomania किस chapter में मिलेगा? There will be four option like sleep, dream will be there, stomach will be there, and mind. तो under minds बहुत लोग stomach मारेंगे क्योंकि desire aversion उसमें है. ओके, तो वो लोग मारते हैं गलत आंसर. डिप्सोमेनिया कहाँ मिलेगा? माइंड में मिलेगा. मेनिया ओपोटू माइंड में मिलेगा. ओके, and alcohol. Can anyone tell me the different medicine craving for the alcohol? क्या क्या medicine है?
Sulfur.
Yes, very good. Sulfur is there. फटाफट बताओ, फटाफट. Sulfur is there. Sulfuric acid is there. Agaricus is there. Next, vomica is there. Ranunculus bulbosus is there. Calcarea ars is there. Syphilinum is there. Sulfur is there. Tuberculinum is there. Trinitrotoluene is there. And Quercus eglandium spirituous is there, etc. There are so many medicine where there is Asarum is also there, Asarum europeum, where there is a craving for the alcohol. Fainting after every stool. Patient is passing the stool and after that faint. Why? Because this patient was suffering from the diarrhea, and diarrhea will lead to the dehydration of the patient, and because of dehydration, when the patient is passing stool, he will be having a fainting. Then we can think about this medicine. And inflamed kidneys following any acute disease, like whatever the disease there, along with that, if the patient is having inflamed kidney, then we can think about this medicine. Enormous distension means too much distension of the abdomen is there. We have already seen in the picture. Okay, so then we can think about this medicine. Okay, enormous distension. Okay, now we'll talk about the relationship. We can compare with the alumen, arnica, arsenic, cantheris, acid, nitric acid, and this medicine we can recommend it, especially prophylactic in case of malaria and African fevers. We can remember. Okay, okay. Thank you, everyone. If there is any doubt, any problem, you can text me, you can ask me, you can call me. Okay.